Hello, my name is Neil Pakenham-Walsh, and I am the Coordinator of Healthcare Information for All. Our presentation is based on one that we gave last week at the Cochrane Colloquium in London. We're going to introduce you to Healthcare Information for All and invite you to complete a survey. But first, I'd like to introduce you to my colleague, Vedant Jha.
Thank you so much, Neil. Hello, everyone. My name is Vedant Jha, and I'm a final year medical student based in India. And I'm also the Southeast Asia Regional Coordinator at Healthcare Information for All. And the crux of our presentation is how HIFA aims to drive transformative change through collaborative action. And we're also going to describe how we do this and what you can do to help. But first, let's take stock of the problem that we're discussing at hand. So a recent study published by Lancet showed that poor quality of care in low middle income countries caused up to 8 million deaths annually. And what we realized is that many of these deaths are likely due to a failure to access and apply reliable health information. And this is a major cause of preventable death and suffering in low middle income countries. And the information is often very basic. To give you an example, a recent survey done in India a few years ago found that nearly 50% children suffering from diarrhea were being given less fluids, contrary to the available evidence. And the survey also found that nearly 1 in 5 of those children who had simple diarrhea were inappropriately prescribed antibiotics, which cause greater harm than good and also contributes to the global emergency of antibiotic resistance worldwide. And we must understand that this poor quality of care is not just an issue for children worldwide or children with diarrhea worldwide, or not just restricted to India, but it is an issue that is relevant to all health systems across all health issues across the globe. Now, I implore you to imagine a world where every person has access to the information they need to protect the health of their own and also the health of others. So what does this information look like? What is reliable health information? So reliable health information is the healthcare information, which is not only accurate and up to date, but is also supported by high quality systematic evidence, like in systematic reviews of available research. It should also be relevant, understandable, and comprehensive, and should also be applicable to the person's immediate situation. Now, coming to what the global evidence ecosystem entails. The global evidence ecosystem represents the totality of actions to generate, publish, synthesize, and apply evidence. So you might be wondering, who all are included in the global evidence ecosystem? Well, to your surprise, it is not restricted to just healthcare workers or primary health workers or physicians, but includes researchers, publishers, systematic reviewers, knowledge brokers, librarians, health workers, and patient representatives. So the whole spectrum of people involved in generating, synthesizing, and applying evidence. And what we find is that yet people's information needs are not being met. And by definition, the system isn't really working. And this is where HIFA comes in. And this is where I'd like to pass back to you, Neil.
Thanks, Vedant. Well, HIFA works in 4 ways. Most importantly, we aim to strengthen communication across the global evidence ecosystem. So these speech bubbles that you see here represent interactions that happen 24/7 on the HIFA forums among stakeholders in each group around the system. We have 20,000 members in 180 countries interacting on 6 global forums in 4 languages. Secondly, we bring together organizations that support universal access, and we now have more than 450 supporting organizations whose logos are shown here. Thirdly, we promote collective advocacy in whole stakeholder groups. Our first success here has been with the World Medical Association, which represents the world's 10 million doctors and which has issued a policy in favor of universal access. And we are working with other groups in the global evidence ecosystem. Most importantly, I'd like to talk about the evolving role of the World Health Organization. Now, WHO is not yet an explicit champion of universal access, but this is implicit in its own constitution, which states the extension to all peoples of the benefits of medical knowledge is essential to health. HIFA published a paper in the BMJ Global Health a few years ago, which concluded that achieving universal health coverage requires universal access to essential health information. And 2 years later, we were accepted into official relations with WHO. Just a few months ago, the WHO Deputy Director General and co-authors wrote a paper entitled "Universal Health Information is Essential for Universal Health Coverage," referring to our earlier paper and mirroring our words. So it does seem that WHO is on the point of committing explicitly to universal access in the coming months, and this would be a game changer. To make this happen, we need a catalyst. And the catalyst is you, the voice of stakeholders in the global ecosystem. Please do complete our 5-minute survey, which is open until 30th of September 2023. We need your voice. Complete the survey today and spread the word. We'd like to thank our supporters, the National Institute for Health and Care Research and the Elsevier Foundation, technical support from JBI, the Joanna Briggs Institute, the IFLA Special Interest Group on Evidence for Global and Disaster Health, Costello Medical Consulting, and just recently joining us, Digital Medic from Stanford University. And for publicity from the Lancet, the BMJ, and the World Medical Association. We need your voice. Complete the survey, spread the word. Together, we can achieve universal access to reliable healthcare information.